Welcome back to part 3 in a 3-part series on stretching after breast cancer surgery and treatment. There are 3 areas of tension that women usually experience: in the chest, in the underarm area, and the back of the shoulder. This video focuses on stretches for the back of the shoulder. Hi, I'm Erica. I'm a breast cancer thriver and a chiropractor. Let's first test the tension in the back of the shoulder. You're going to lie on your side with your affected side up. Keeping your arm straight, can you get your arm close to your ear? For the second test, you're going to start with your back against the wall. Keeping your arms straight and your hands on the wall throughout, can you raise your arms up so that they're beside your ears? With both of these movements, do you have full range of motion? Do you have pain or tension as you're going through that range of motion? This video will help if you had deficits in your range of motion or pain or tightness going through that range. What causes all this tension? Changes with surgery is the first thing. We're not going to be moving our arms the way we were before, and so some of those surrounding tissues are going to tighten up as a result of that. It's common to have a forward posture after breast cancer surgery. If you got tissue expanders and you're going through that tissue expansion process, there's usually additive effects of rolling those shoulders forward as well. So in both of those cases, the back of the shoulder and the mid-back tend to tighten up to offset that forward posture. Radiation side effects. Now, the back of the shoulder isn't in the radiated field, but some of the surrounding tissues are, and so that back of the shoulder can tighten up as a response to that. When can you start doing these stretches? The same with the 2 previous videos, at about 4 to 6 weeks after surgery, and check with your healthcare team on that. What equipment will you need for this series? Just a table and chair. The first exercise is table slides. You're going to sit on a chair perpendicular to a table and rest your hand on the table with your thumb pointing up. Lean to the side and gently slide your hand away from you as far as you can. Hold this extended position about 5 to 10 seconds and repeat this for 10 repetitions. You can expect to feel this stretch in the back part of your underarm or directly in the back of the shoulder. Some women will feel it going down that back side of the trunk or also into the back of the arm. You're basically going to feel it where you're the most tight. The second stretch is an overhead reach. You're going to lie on your side with your affected arm by your side. Keeping your arm straight, you're going to lift your arm overhead to feel a stretch in your outer armpit area and or the back of the shoulder. To progress this stretch, you can take that top leg and move it behind the bottom leg. If you're doing this stretch on the edge of a bed, you can actually hang this leg over so it dangles down. Moving the leg serves to deepen the stretch because you're essentially pulling from the arm and the leg, so pulling at both ends. You want to try to avoid rolling your body back as you're doing this stretch, so try to keep your hips stacked one on top of the other. Another progression is reaching your arm to hold on to something. If you're doing this at home, the post of a bed or a couch can work well. This provides a deeper stretch to the entire side, and you're going to feel it wherever you're the most tight. You can vary the angle of this stretch to address different lines of tension. So if you get into a position where you feel quite a bit tighter, just hold that position longer. If you want more self-care tools to address some of the side effects after breast cancer surgery and treatment, hit subscribe down below.